For all the latest updates, subscribe to News 9.
Hello, you are watching News 9 Digital with me Amrita, and I am going to be talking about whether novel coronavirus affects smokers or not. Now, during the initial stages of the pandemic, some studies and observations revealed a very weird theory with this connection between smoking and COVID-19. This theory said that smoking somehow provided protection against the COVID-19 virus. However, so far there are no peer-reviewed studies which have proved this or otherwise. Now, the World Health Organization, despite a lack of evidence about whether smoking provided protection against COVID-19 or in fact made the smokers more vulnerable to infection and severity of the cases, has cautioned against the habit. Now, similarly, in the latest, the Union Health Ministry in India has also cautioned against the ill effects of COVID-19 on smokers as well as tobacco consumption. This is what one document by the Union Health Ministry reads.
Smoking impairs lung function, thereby reducing the immunity and making it harder for the body to fight off various diseases. Smoking, e-cigarettes, smokeless tobacco, pan masala, and the like product use can increase risk and severity of pulmonary infections because of damage to upper airways and a decrease in pulmonary immune function.
Now, the document by Union Health Ministry further stated that the act of smoking means that fingers and possibly contaminated cigarettes are in contact with the lips, which increases the risk of transmission of COVID-19 from hand to mouth. Furthermore, the document also mentioned not just about conventional cigarettes but also about smoking products such as hookahs or water pipes, which also involves sharing of the mouthpieces and hoses, which could facilitate the transmission of COVID-19 in a social gathering setup. Now, there is still very little research or literature available which talks about the connection between COVID-19 and smokers. However, a scientific brief that was published by the World Health Organization on June 30th of 2020 says that the available evidence suggests that smoking is associated with increased severity of disease and death in hospitalized COVID-19 patients. However, at the same time, it mentions that there is still little evidence about the kind of risk to smokers who are hospitalized with COVID-19 or of infection by SARS coronavirus 2. Now, in both the cases of World Health Organization and the Union Health Ministry, both recommend against the use of tobacco as well as smoking. They say that there is well-established harms associated with tobacco use and second-hand smoke exposure, which should be enough evidence that smoking is harmful during this pandemic stage as well. Now, let us go back to the earlier studies during the initial stages of the pandemic, which reveal the weird theory. University College London academics looked at 28 papers and found the proportions of smokers among hospitalized COVID-19 patients were lower than expected. One public health professor termed it as something weird going on between the connection, and one of the studies showed that in the United Kingdom, the proportion of smokers among COVID-19 patients was just 5%, a third of the national rate of 14.4%. So while there might be little evidence to prove either of the theories about smoking and COVID-19, given the fact that smoking does kill and is associated with several non-communicable diseases and as well as lower function of lungs, it needs to be considered that smokers might also be vulnerable to COVID-19, as COVID-19 attacks the respiratory system. You can leave your opinion in the comment section down below of what you think of smoking and COVID-19. Also, like, share and subscribe to News 9 Digital.